Hello, everyone. My name is Matt Elliott, and today I want to talk to you about HIV and AIDS for the week 6 assignment. The first thing that probably comes to mind is what is HIV? HIV stands for the Human Immunodeficiency Virus. If it's left untreated, HIV will become AIDS, which is the acquired immunodeficiency syndrome. HIV attacks the CD4 or T cells, which helps the immune system fight infection. Um, and the HIV virus actually reduces the number of T cells, so it makes it harder for the body to fight infections. I mean, everything from the common cold to pneumonia. Pneumonia is actually that much worse for someone that is also suffering with HIV. It should also be known that the human body cannot get rid of the HIV virus completely. Therefore, once a person's been diagnosed, they will have the virus for life. As of now, there currently is not a cure for HIV, but it can be controlled with proper medical care and medications. The medications are known as antiretroviral therapy, or ART. Um, if, as previously stated, if the HIV is left untreated, it will become AIDS, which is the final stage of the HIV infection. However, with treatment, most do not advance to this stage. So, what actually causes HIV? The HIV infection occurs when direct contact is made with certain body fluids of an infected person. HIV can be passed through blood, semen, rectal and vaginal fluids, and even breast milk. And in the United States, HIV is spread through sexual activity and needle or syringe use. It cannot be spread through casual contact. Um, Specifically in the United States, it's contracted primarily through anal and vaginal sex, or share needles for injection drugs. And I found out tonight that the virus can live in a needle for up to 42 days. That's a long time. So the next question in the discussion of HIV is, so who's affected? In the United States, the highest risk are gay and bisexual men, particularly young gay African American men. According to the 2015 statistics that I was able to locate, gay and bisexual men account for 82% of the diagnoses among males and 67% of all diagnoses. African American gay and bisexual men account for the largest number of diagnoses, followed by white gay and bisexual men. And as previously mentioned, there are medications now available to treat individuals that allow them to lead healthy and productive lives. The infection rate varies by ethnic background, and these stats were gathered between 2005 and 2014. There actually has been a decrease of 18% in gay and bisexual white males. However, diagnoses rose 24% among gay and bisexual Latino males and 22% among gay and bisexual African American males. Heterosexual contact accounts for 24% of diagnoses. Women accounted for 19%. However, there has been a decline of diagnoses, 40% overall. 6% of those diagnoses are attributed to injection drug use. So lastly, we would want to talk about prevention. So you want to know, how do you prevent from getting HIV or AIDS? Primarily, you're going to be looking at, safe sex options. So, always using condoms. For individuals that may have a partner that is HIV positive already and they're not, there is a medication known as PrEP, PrEP, which stands for pre-exposure prophylaxis. And you can go to your doctor and get a prescription for this medication. And once you take it regularly, it's going to lower your risk of contracting HIV. And lastly, we all know that drug abuse is never a good thing. However, any type of IV medications the person may have to take, even if it's prescribed, you don't want to ever share needles, because again, as previously mentioned, the virus can live in a needle for up to 42 days. So that's over a month. So again, safe sex practices and not sharing needles, goes a long way in preventing HIV disease.